Well, look, it's the military special interest group, so I think we're obliged to start bang on time. Can I just, on behalf of the Institute, thank Paddy McKillop-Duffy, Group Captain Paddy McKillop-Duffy, who today is going to be talking to us about the HQ Defence Medical Services Leadership Culture and Behaviours Centre. Paddy, I can't wait to hear a little bit about this, and I'm grateful to you for giving up some time. What are you going to speak for? About half an hour, something like that?
Yeah. We'll see how things go, and open it up to people to have a conversation. And I think there's an interesting conversation to be had about it coming at it from, say, a military perspective, because it's something that is still quite dominated by urban myth. Well, look, afternoon.
Well, let's hand it over to you. I'm just going to come out of the spotlight. Over to you, Paddy. Thank you.
Well, afternoon all. Two apologies from me up front. Firstly, my attire. I'm jumping on a train straight after this, so hence the sort of dress down mode. Secondly, I had planned, and I had invited Headquarters Air to come along to talk about some of their cap dev work, but unfortunately that just didn't work out because of all manner of things. So I sub apologies. That means you have me again in that sense. In terms of what's been going on since we last spoke, I was conscious in our last meeting it all sort of felt a bit doom and gloomish with everything that was going on, and I got to say nothing's improved other than the Loop magazine has dropped into your inboxes now. I've got to say some fabulous stuff in there, right up my street about compassionate leadership, but also some really interesting takes in there on issues such as Black women in care. I mean, really worth your while to work through the pieces in there. I think it's a fabulous piece of work, John. We've had a fiscal event. We're not allowed to call it a budget or a mini budget. More questions really than answers for me. So how do we reach that 3% of GDP on defence spending without fudging it, as we've done in the past? The national insurance rise scrapped. So what does that mean for, in the short term, the money that was pegged against sorting out wait times in secondary care, which that was part of? But more importantly, what does that mean for social care? And where is that money going to come from, if indeed the government is sticking to some kind of plan for sorting out social care? So all eyes on the 23rd of November for that, I suppose. Yes, absolutely some help for households when it comes to fuel bills. Not so sure about business and people providing healthcare, be you a hospital, be you a care home or other, because it's frozen for 6 months, and I've yet to meet anyone in business that buys utility in that way. So a lot of soundings about that, and then just what about all the rest of it? That is facing people. And when you think about in healthcare, that I suppose many people view healthcare and maybe some of the high price help there, be you a consultant or whatever, very senior manager and everything else. But I imagine the bulk of healthcare is delivered, be that in directly or in some kind of support function, by some of the lowest paid in society. And here we are yet again, where I don't know, the race to the bottom in remuneration packages and contracting and subcontracting and everything else. Those are the people who tend to suffer. So yeah, more questions for me. We also had, with respect to Ukraine, Putin's speech and the annexation piece. The great powers tensions are still there, and of course, all eyes are on Putin now, and particularly Valery Gerasimov. In terms of what they do next. Their options are shrinking. They really are shrinking, be that in a geopolitical sense, be that in a strategic sense, or an operational tactical sense. So all eyes, are on Ukraine at the moment, and our Ukrainian sisters and brothers, really. And then, of course, we had the passing of Her Majesty Queen Elizabeth. God bless her, and God save the King. What a 10 days, really. I think as a nation, I picked up on just a sense of huge pride, of course, in her representation of our nation and what she meant for our nation. But then, of course, as well as members of our armed forces who were involved throughout. Everybody in the country now knows about Op London Bridge. It's been sitting on a shelf for ages, but everybody knows about it now. And I know for me, actually, it sort of led to periods of reflection, really, when you think about Her Majesty's service and to our nation and to us as citizens and subjects, to think about the nature of our own service. And how, for some of us, and I stress it is some of us, having that as I don't know, a model, a reference point for serving is tremendous, really. And before I jumped into the presentation piece of this, I just wanted to offer people the opportunity, if they did want to say something about Her Majesty's passing, and that period of time and looking to the future, please do so. Does anyone want to add anything or offer anything? We're all good. We're quiet. Okay. Well, look, as I say, not Headquarters Air, but me. I chose to really draw out a topic that I was given a special project by Peter Homer, our DG, in my previous job, to develop a leadership culture and behaviours charter for the headquarters. Now, I tell you what, I'll fire this up now. Has that come through? Brilliant. Okay. Note that on one more time. And yeah, as I say, under each sort of behaviour, we give some examples of what we felt were important. I suppose the first question you ask is why? Why the need for this? Well, the first thing to recognise is that, as with any organisation within Headquarters DMS, in essence, we have a clash of cultures. What I refer to as the defence pot. So you've got 3 separate services with their own distinct cultures and associated behaviours and the likes. We have the civil service, which is another culture in itself. You have contractors and partners. All of the above we would refer to now as the whole force. It's not just about people in uniform, it's about our civil service and other partner colleagues. You also have command cultures as well, where each of the commands, and we have 4 commands now, we have the Royal Navy, Army Command, Royal Air Force and Strategic Command, we refer to as the military commands. They have their own command cultures, and depending on who is the comm at any particular time, they have a distinct say and influence over the culture at the time. And in the context of that, we found that sort of generating a one DMS culture is quite a difficult thing to do because of all those things creating tensions. Another aspect of the why were what we would refer to as, in a way, the atmospherics. Not long after DG came in, when he was doing sort of his visits around and getting to know people and getting to know the business, he sort of picked up on some behaviours, some of them subtle, maybe some others not so subtle, that he was a bit perplexed by, really. I would go as far as saying that maybe if they were experienced or seen in other spheres of work and business, they might be perceived as being quite heavy-handed or almost bullying and harassment in a style. There were indicators out there, so repeatedly in the likes of the People Survey and to an extent the Armed Forces Attitude Survey, there were always repeated references to poor leadership, bullying and harassment. And in a way related to that, there were other indicators like staff absence, recruitment and retention issues in some areas. Also issues around performance as well. You know, when you can't keep staff, there's obviously going to be an impact on performance. But if you've managing to retain a workforce, but that workforce is unsettled, upset, etc., etc., feeling bullied or harassed by way of example, obviously their performance levels are not going to be the best. And then finally, in terms of why I mentioned earlier, DG made a commitment inside our DMS people strategy, which was quite simply, the DMS will be the best place to work in defence. It'll be recognised as an empowering, committed, rewarding employer that values and respects its people. Quite simple, but I think historically, in the context of I suppose the military world and the military way of doing things, it might be quite strange to some people having it framed in this way. Now, off the back of what DG had recognised and all those other indicators, we started work on trying to define what we saw as being the right leadership culture. And in relation to that, we looked at work from, or I say everywhere really, places like the NHS Leadership Academy, NHS England, various universities, etc., etc., and started to sort of whittle that down into those areas that we would like to focus on, and helping us define those 5 core leadership behaviours that we wanted to hone in on. And it was around the sort of culture and the social behaviours, fostering trust and valuing people, and cares for people's well-being, enables them to do their best work, directly tying into the vision. A really important thing about building a shared purpose. One of the things, especially when you're in the midst of a major transformation program, for instance, is one of the huge challenges is getting your people behind the vision. It's a real massive challenge, in that sometimes visions associated with portfolios and programs can seem so distant for people. It really is incumbent on, but acknowledging the fact that it's very hard work for the leader to communicate that vision, relate that vision to people's everyday work, their work well-being, etc., etc. And it's important because if you don't get people behind it, you'll find it very difficult, if you do at all, to realise that vision. We thought that this culture had to be right for developing and sustaining high-performing teams, and especially in that context of change and transformation that I mentioned earlier. Another really important aspect of this was the outcome of the 2019 Wigston review that was done in defence, you know, about our leadership and some of the behaviours internally within defence, and I'll give you an extract from that at the moment. But one of the things that became, I don't know, of increasing focus for me and a waypoint of sorts was this quote from Simon Sinek. Now, sometimes I've got to say I can be a bit of a critic of the modern leadership gurus and their YouTube and TED Talks, you know, and everything else. There's a place for everything. But this one from Simon really, really struck me in that leadership is a choice. It's not a rank. I know many people who are at the bottom of organizations who have no authority and they are absolutely leaders. This is because they've chosen to look after the person to the left of them. They have chosen to look after the person on the right of them. This is what a leader is. And I think that is certainly something within the sort of headquarters DMS that we are probably guilty of. We tend to automatically associate leadership with a position of authority or a rank, when actually some of our most junior people out there are true leaders, absolutely leaders. I referred to the Wigston review about inappropriate behaviours in defence. I think one of the artful things that the Air Chief Marshal sort of honed in on here was he related it to ultimately the operational performance of the armed forces, and that, you know, our hard-won reputation can be lost in an instant or whittled away over time, really, if we persist with some of these behaviours. And after all that whittling down and everything else, as I mentioned earlier, you know, our view was that the right leadership culture was compassionate and inclusive, psychologically safe, authentic, inspiring, engaging and empowering, collaborative and selfless, agile in the flexibility of complexity and uncertainty. That last one about agility, again, is one that I find absolutely fascinating. You know, I think I recall a chap called Harvey Neve giving a lecture. Harvey used to be at Public Health England. I think he's now set up his own consultancy. But he gave a talk about sort of leadership in the context of the future and its varying demands. And I remember him saying that, you know, if you try and come at the demands of the future in a traditional command and control style, you're going to fail. You're going to absolutely fail, because it's far too complex. There are too many uncertainties out there. His view was that the role of the modern leader, or today's leader, is to set the vision with our people, agree a governance framework, and then get out of the way. Let them do it. You spend all this money looking for these people, recruiting them, remunerating them and everything else. Let them get on with their job. Let them do it, you know, because that's why you've employed them. And it always struck me when Harvey put that to the audience at that conference. As I said on the slide in the opening, we isolated sort of 5 core behaviours within the charter, and we took all of that and then developed a learning package. This learning package, it's based online. It has a series of sort of presentations or presentation blocks in there, and reflection exercises as well, to encourage people to engage in those. It's access for all staff, be they military or civil servant, trainees, etc., etc. It's not mandated training. We did tussle with this idea because some elements of the senior leadership team did want it mandated. Others thought, well, actually, we've got mandated training overload in pretty much every organisation now. So we kept it as not being mandated, but encouraged. As well as doing the online package, all participants are encouraged to take the learning forward with the support of their line manager. And really the foundation for doing that is not only collaborative work, but also a self-assessment tool that we devised for people to measure themselves insofar as they can in the various spheres of the model or the charter. and decide on which pieces they would like to sort of pay more attention to, and with the assistance of their line manager or a mentor, take that learning forward. And that's just a cut out of the package there. This in itself, those of you who have done the NHS Leadership Academy self-assessment would recognise this as well. Very much sort of a target board framed around various elements of the charter itself, be that the behaviours or the various components of what we feel the right leadership culture is. For example, there, psychological safety or empowerment. We ask for a commitment, recognizing that using this, I suppose, this tagline of "we are leaders," and really reinforcing that point that we are all leaders, is that we ask for this commitment from people to champion the right leadership culture and to model the behaviours. And as well as this package, relating to other packages out there, be that with unconscious bias or inclusion type packages, go that extra step where you can to call out, by way of example, behaviours that do not fit this. So some reflections from me, really. So what went well? I haven't put it on here. Oh, I have actually. So first things first, I think for me, it was the learning experience of it. I think throughout your military career, when you are pulled back into the education system and development system, you're exposed to various leadership models and theories and the likes. I found that this was really useful exercise for me to in a way sort of recognize the shift of some of the thinking, and some of them are quite big shifts in thinking when it comes to leadership styles. And it was great learning for me as well because of the ability to reach into people's work. The NHS People Plan, for instance, the Leadership Academy, Michael West's fabulous work, by way of example, and associated work coming out of the King's Fund as well. So it was a super learning experience. Part of that learning experience as well was, that mental effort to say, well, okay, so how can you make that work within the military? And you can actually get yourself wrapped around the axle and making this hugely complicated, in trying to get to that. What helped me the most actually was lifting a couple of books by General Stan McChrystal. I had the great fortune to work for General Stan out in Afghanistan, and formidable person, formidable thinker. But what in a couple of his books, this is absolutely the type of leadership that he talks about, especially being a proponent of everyone is a leader. And genuinely believing that. And I'm glad to say he's carried on that work. Now he's set up a consultancy, and as part of that consultancy, he runs a program called Insights. You can stick that into Google or whatever platform you use, and there's a whole series of videos and discussions in there, around his view on leadership today. I think the other thing that went well was the senior level buy-in. I've got to say, obviously it came as a direct task from DG, so that was one level of buy-in, but noting that the majority of the rest of our senior leadership team are military, I was really impressed actually about the level of buy-in from them, because they could have turned around and said, no, Paddy, you will develop something in a very sort of traditional military style, etc., etc. But I imagine they recognise that, you know, you risk alienating a huge chunk of the workforce, in particular our civil servant colleagues. There was massive support, I've got to say, from various business enablers, the Defence Medical Academy, who have previously spoke to us about their leadership program, and our graphics people and that kind of thing, who then helped me develop the learning package and get it hosted on the site. I haven't put it on there, but I think another thing, a personal thing for me is, you know, in terms of what went well, is there was no massive abreaction from my military colleagues. There was a few comments here and there saying, Paddy, that, you know, this is a bit sort of fluffy for the military and this kind of thing. And I sort of pointed out two things to folk when they mentioned that. I sort of offered two things to folk when we mentioned that. You know, I think the thing that people abreact to is the terminology, probably. You know, use a term like compassionate and they think, well, okay, what does that mean, type thing. But as a junior soldier, by way of example, and as a junior soldier leader, that is what you're taught from the outset. You're taught to look after your people. You know, you're taught to rest them, feed them, make them change their socks, etc., etc. You know, look out for the welfare. For me, you know, that's a type of compassion in there, which is all about performance. I think the other thing I offer as well is that even if a situation dictates that, because of time pressure, the nature of the threat, lack of resource or whatever else, dictates that things are very pacey, racy, compressed and feeling compressed, people still deserve respect. You know, I heard some reports from NHS colleagues in the early days of the COVID crisis, and when things went to level 4, and that, you know, some of maybe the behaviours that were associated by that with that sort of command and control, I think people assumed that we in the military recognised that and bought into that kind of thing. And I have to say that, you know, I said to a number of people, I don't recognise it at all. You know, that's not command and control. In many instances, that's just plain bullying. And it's not welcome. It just isn't welcome. What didn't go so well? There are a few. Firstly, the COVID crisis and remote working and learning. Your audience all of a sudden becomes not so captive. When you have them in a big headquarters building and everything else, where you've got media screens and all that kind of thing, that you can push messages out, drop leaflets here and there, and, you know, organize get-togethers, you know, over coffee break, that kind of thing. All of a sudden that was gone. And that was about the time I was trying to deliver this. In relation to the latter as well, though, there was just, I don't know how you felt it in the NHS, but for us, it was just information overload. I mean, this shift, you know, coming away from the office to working from home and everything else, all of that stuff that would trickle down to us inside the building all of a sudden was happening online. And, you know, frankly, I think there were points where people's eyes were just bleeding, reading all these online updates and the emails and, you know, and everything else. There was a lot of information overload at the time, so it was very hard to land this at the time. I think the third one there, I felt I was sort of competing with other activities that were going on at the time, not least the development of the Defence Leadership Programme, you know, which again was very high in DG's priority and a huge success. It just felt like at times it was sort of, I was competing with that in some ways. We had other organisational priorities and as a result, I think the message of this was sometimes drowned out, in particular by our transformation program. And maybe I should have put more effort into or thought more deeply about creating a formal relationship between this and that transformation program. You know, a massive priority in any organization when you're chasing down those strategic objectives through transformation. Naturally, this kind of thing can get drowned out by that. And then the final one observation for me, you know, on a personal sense, you know, there was that constant thing of the competition between what are your primary duties and these special projects. You know, so sometimes trying to get after the work that was required for this particular landing this particular task was drowned out by the primary duties, and again not helped by the crisis then with respect to COVID. And I think that is it, and I will now end the slideshow and open it to the floor if anyone does want to jump in there.
Thank you very much, Paddy. Your diary is currently
that chock-a-block diary.
There you go. There you go. Well, thank you so much. There's a lot going on, isn't there? Goodness me.
Yeah.
There's a lot that has gone on. I love the fact that Peter and yourself have actually spent time really carefully considering the charter. And indeed, I was going to point members who are on the call today to our own code of practice, which we brought in 3 or 4 years ago now, and that we've just updated. I can see we've got Peter and John and David on the call. Would any of you like to make any comments to Paddy at all? Peter, you're muted, Peter, at the moment.
I'm not.
John, would you like to go? You go ahead.
All I was going to say was well done on persevering. I do know what it's like over at DMA. And leadership, management, leadership in healthcare. These are buzzwords which have been bandied around since General Bricknell's time, especially. So to actually see progress and a product which we can take forward is a good step forward. I was just asking on the chat, the package you're talking about, is that hosted on Dean 2 or DLE?
It is. It's now formally on Dean 2. You know, so it's there, both the package itself and the reflective exercises and the assessment tool as well.
Cool. My only other question is, we do have the virtual defence medical leadership site. We have the good work that you're doing. We've got the single service generic leadership and management courses. What a good colleague of ours is trying to do for our branch is get some academic accreditation qualification. Can you see any of this coalescing into something which could be of use?
Yeah, so I think with respect to the charter, you know, I think it's something different. You know, this is about, in a way, helping DG and the SLT set the right leadership tone, and everything that comes with that, be that modelling behaviours and stuff. I think those behaviours and that approach naturally will assist anyone, you know, undertaking a development program in future. And I think one of the things we liked about this potentially about this approach was that, you know, you're giving someone a tool to take into, say, a mentoring type relationship, their general personal development, and you know, I want to be better you know, at this, through to the more academic stuff that you're talking about, you know, that this can sort of sit in the background. And there are a number of hooks in it as well that, you know, especially in relation to the works of the likes of Michael West, you know, that, you know, there are links inside the package to go more deeply into the likes of his work and Shine's work on culture and psychological safety as well.
Cool, thank you. I've got as far as getting the Dean site open. I'll log on after this meeting and have a look. But it's I've just had a bit of leadership discussion with our medical reserves leads, and this is another resource which they can take into, and
absolutely,
because our reservists can access Dean 2 from outside the system, it's another resource which they could definitely make use of.
No, it's super, John. And you know, if any of the squadrons ever want me to go along and, you know, have a chat about it, you know, they're more than welcome to just ask.
Smashing out. Great, thanks very much.
Thank you, John. Peter, you were going to speak, and you were...
Yes, thank you. I mean, firstly, Paddy, this is a really tremendously useful bit of work. I can see it, having experience both in the my military life, and the NHS, and I can identify many facets in it. And I reflected and I thought, I wish between 1961 and 1970 something was available. One picked that up later in life. One of the questions, really, a couple of questions. I mean, do you believe, and I think I might be answering my own question, do you believe that the medical cohort approaches leadership differently from non-medical cohort? So in the sense that within the NHS, most of the people in the medical field will be professional people. In non-medical, there are not so many who are non-professional. So that's one aspect. The other question is, how different is this leadership model from, say, the model that Sandhurst engages in? Is it different, or are there a lot of similarities?
I'll deal with I suppose your second one first, Peter. I think the terminology is certainly different, but I think essentially the core elements of it are the same. You know, and if you look to meet leadership models, say, for instance, Adair, for instance, you know, that kind of thing, they're very easily relatable, really, really easy, you know, relatable. And I think, you know, what we must recognize that, you know, when we have cadets going through the academies and, say, you know, our junior leaders, you know, going on their first journey as a lance corporal or equivalent, you know, that is very much framing the learning around where they're at in their life and their career then. It can sometimes be a bit simplistic because it has to be, especially when, you know, when you're bringing cadets through the likes of Sandhurst and that now, you know, as a commandant and as a director of learning, you know, you are faced with so many things that you are to smash into that curriculum. You know, naturally everything sort of gets things down, but I think the trick, though, of the whole thing is making it all interrelated. You know, and coming up with a program whereby, in a way, you force the penny to drop in the individual themselves. You know, so when they're out off on a yomp, on a command task on Salisbury Plain somewhere in the pouring rain or the snow and all this kind of thing, you know, and hopefully there's a moment in one of those tasks over the year or so that they're doing this, that, you know, the penny drops from that learning, and then we build upon it later on, Peter, with, you know, obviously doing, you know, the emphasis now being on command and staff courses. So everyone has to do a junior block command and staff, then an intermediate block, and then get selected for the advanced. If they're fortunate to do so, and so it's building it all along. But I suppose our view is you shouldn't have to limit it to those times when you sort of dip in and out of formal, leadership and development education. Trying to relate that to everyday practice and making things better for our patients, making things better for our colleagues, and making things better for the organisation, I suppose, as well. And I think that's been one of the wonderful things about Michael's work, Michael West's work, is that, the moment Michael framed it as and demonstrated that it's directly related to performance and patient outcomes, people had to listen. I think, if you took that bit out of it, everybody said, "Oh yeah, fluffy stuff," this kind of thing. I'm under pressure and all this kind of thing. But the minute you frame it in those terms, I think that was a magical move. Really, really brilliant thing to do. I think in terms of difference, I think that there probably are differences, but I genuinely am one of those people who, I think celebrate, those differences. I'll give you an example. I am the chair of our equivalent of IFR ModCap, and I insist on having a blend of people on the panel. Some of them clinical, some of them not clinical, some military, some non-military. Those civilian non-medics, are just a fabulous resource for me, because they can, in a moment, take me out of my traditional military and clinical thinking and focus me on something that absolutely has to be focused, because they're thinking about it as, I don't know, being an accountant, being an administrator, or whatever else. So those differences are just fabulous, and make us what we are, as an organization. I think a lot of us as well, though, aren't we? We're used to a very traditional medical and nursing education that you're dragged up through, and there were the hierarchies and the pecking orders and everything else. I think I'm glad to say that we're seeing more and more evidence of that changing these days. Yes, the consultant probably still is God. However, he hopefully he goes about his business in a much more pleasant and respectful way with his or her trainees. I hope that answers it, Peter.
There we go. And we've got David would
Thank
like
you.
it.
Yeah,
He's got his hand up as well. David.
Hi, David. Good to see you.
Yeah, hi Paddy, hi team. Yeah, thanks for that. That was interesting. Some of it I'd heard before at the conference a couple of weeks ago.
Good.
In Carlisle, Lancaster.
Yeah.
It was good to see some of the workings out as well. Your last but one point where you were, I think. You were talking about or implying that this needs to be blended into everyday business, and your comment previously about your primary role and special tasks sort of conflicting. I was having this conversation last week. I was running a workshop, but it was based on graduate nurses transition to practice, that thorny issue that's been around for the last at least 3 decades since I've been in the business, if not longer. And my sort of, I was facilitating it, but my sort of take on it from a transformative learning perspective was that this is a continuum, as you were saying, with military courses, with promotion courses, you've got those set points in time where you do your corporal's course, your sergeant's course, your warrant officer's course, all the way up, and there's staff courses. But this is more of a continuum. It's something that needs to be threaded through, which lends itself to transformative learning. So that's really what I based my my thesis on, and your point about I can't remember what it was now, but I've sort of interpreted it as building intelligence. It was the agility issue.
Yeah.
It's building intelligence into the
Absolutely.
system. And the only way you can do that is by educating people to be able to fuse their education, training and experience. And I've developed a capability model, which goes back to when I was in MOD back in the early 2000s, where I always used to get irritated with tepid oil, the capability development model, because T is training. Training doesn't come before P, which is people. So I've always put people first, and then try to educate the certainly the wider military that training and people are core, and then everything after that is an adjunct. So you give them equipment to help them do the job.
Yes.
You don't start with training in equipment and then put people third. And that sort of brings me on to my major point, which is I think there needs to be a paradigm shift in the way med is perceived within the military. And again, this has been a fight that I've been having again all the way back to my early days in the MOD. You remember the days when we were talking about NATO J10 med being a separate entity rather than being folded into personnel or logistics. Actually, we think it needs to be more fundamental than that, a more fundamental change. And med is all about it's all about the capability of the force. It's integral. So I've always looked at putting it in J3 in operations with force protection, or as because even when we were in Šipovo in Bosnia running the NATO hospital there, we advertised that to the commander as a major force protection asset. Because if it was a hospital, he wasn't interested in it.
Yes.
So we've got to adapt our language and be more intelligent at how we brief our commanders and educate our commanders, but change our capability stance so that we are integral to the mission. And that's happening now in civil affairs and in CIMIC and in gender. So all this mainstreaming we've been talking about over the last 10-15 years is actually coming to fruition now, because commanders are realizing that it is essential that you have your CIMIC teams, your civil affairs teams, your gender advisors on the staff, not as J9 but as civilian support, but actually they're in J3 ops and J5 plans.
Yeah, I agree wholeheartedly. I think, on your first point, when I listen to people like Michael talk and others, the lens I'm looking through is that, it's not a piece of extra learning. It's not part of a development program. It's a way of practice. It's a way of being, in a sense. My early days, I did Rogerian, Carl Rogers psychology. And he talked about, on becoming, and I think this approach to leadership, it is just a way of practice, a way of being and interacting with your professional world and the people in there. On agility, absolutely. I think the big thing about agility is just think about the risk, and especially in the context of today's world, and we're back into this sphere of great power tensions and, God forbid, great power conflict. Agility is going to be at the very heart of that because of the type of battle space they seek to create and make and force you to operate in. You have to let go of some of the strings and accept that I cannot wholly understand this and control it, etc.
But what we can't do, Paddy, is abdicate responsibility, because that's what we've seen in the past as well. Mission command is well characterised, but the number of times I've seen young corporals and lance corporals and privates sent out to do a task or on a mission, and their commanders haven't supported them. Because I said, no, that's your responsibility. And that was another thing that I was discussing last week, which, in civilian practice has come out in South Staffs and lots of other wicked issues. But, it's when the managers and the leaders actually say, well, it wasn't me, you did it. You were given a job and you made the mistake.
I think many of us are waiting out, David, for that moment when the historians finally produce that debridement, I suppose, of what went wrong in Afghanistan. you know, because, you know, many of us can point out that, you know, the outcome that we ended up with was written into the plan from the outset. It was there, it was evident, you know, and actually all we did over 10 years plus was create a greater fog around it, create a, you know, this scourge of positivity that permeates politics. You know, you're only allowed to deliver a positive message, you know, bury or hide or fudge the negative stuff, you know, type thing. You know, one day the historians will write it for what it was, you know, and hopefully be some learning out, you know, from that. John, I'm noting the time.
Yeah, we're about there,
just
Paddy.
to
I'm grateful to Peter and John and David for their contributions. I'm immensely proud to have you as our chair and our presenter today. I'm most grateful to you indeed for it. I know it takes time. I know you've got something else you've got to zip off to now.
I'm off to do some leadership training actually for the next 3 days.
I'm very delighted to hear that somebody's been farsighted enough to pick you up in that regard. For today then, I think that's probably it. Do keep a lookout for the next one of these. And doubtless Paddy and Jade and myself will be discussing some further events during the coming few months. We look forward to seeing you then. But for today, I think that's it, Paddy. Thank you very much indeed.
Thank you all for joining. And thank you, John and Jade.
Thank you.